Hi everyone, in this video we are going to discuss about the topic hypertension. What are the causes of hypertension? What are the types of hypertension? What are the clinical features of hypertension? How to manage hypertension, both the lifestyle changes and pharmacotherapy. Each and everything we are going to discuss in this chapter. Okay, let's start our discussion on hypertension. Hypertension is nothing but the silent killer disease. It is nothing but silent killer disease. It's called hypertension. Okay, we are going to discuss what is hypertension. The pressure exerted by the blood vessel is called hypertension, measured by sphygmomanometer. The width cuff is greater than 80% of the MAC, that means medium circumference. It is greater than 80% of the width. Okay, next we are going to know few details about this sphygmomanometer. There are two types, manual and automated. In manual you are going to use the mercury column as a in order to read the recordings of the BP, both systolic and diastolic. Here we are going to discuss some more point, that is what is meant by auscultatory gap. The auscultatory gap is nothing but the period between the sound appears and disappears is called auscultatory gap. If where the systolic pressure is our phase 1, that is Korkov sound 1, there are noise, and phase 5 or 0 is phase 5 is called as our muffling or disappearance sound, where we are going to refer it as an diastolic BP. Okay, this is the instrument we are used to measure our BP, but intra-arterial catheter is used to identify the BP more accurately, because these are all under, if it is a machine error is there, it is an observer error is there, is a subject error is there, so many conditions are all we are there is to discuss this. Okay, we are going to discuss Jane classification of blood pressure. What is meant by normal blood pressure? It is less than 120 mg per Hg systolic blood pressure and greater than less than 120 by 80 is called normal blood pressure. In pre-hypertension, it is up to 120 to 139 in systolic blood pressure or 80 to 89 in diastolic blood pressure. In stage 1 hypertension, we are going to discuss is systolic is 140 to 159 and diastolic is 90 to 99. If it is in a stage 2 hypertension, it is greater than 160 by 100. Okay, we are going to tell one more thing, which is called isolated systolic hypertension, where the hypertension present in the reading systolic is greater than 140 and diastolic is less than 90. In this condition, we are going to call it as an isolated systolic blood pressure. Yes, we are discussed here. Isolated systolic blood pressure. Systolic blood pressure is greater than 140 mm of Hg and diastolic blood pressure is 90 mm of Hg. In this condition, we are going to call it as an isolated systolic blood pressure. Okay, moving on to the next. What are the risk factors of hypertension? There are two types of risk factors. Mainly they are modifiable and non-modifiable. Let's discuss about the non-modifiable, the age and genetic factor. We can't change it anymore, because age, once we reach, we can't change our age. And genetic factors which are obtained from our parents and through their genotypes, we can't change it. What are the modifiable changes? Only we are going to modify it, like diet. The best diet is our dash diet, which are we are going to discuss later. And physical activities helps in the reduction of the weight, and it helps in the reducing the BP. And also obesity leads to the one of the most important factor. And in obesity there are so many problems occurring. Okay, sedentary lifestyle also leads to hypertension. If you are going to actively participate in the work and doing your duties with wholeheartedly, then you are going to be an active person. It results in reduction of the BP. Avoid smoking and drinking alcohol. It is a mainstay, because smoking and drinking alcohol leads to somewhat increasing the pressure due to the nicotine present in the smoking, that means cigars. Okay, these are the modifiable and non-modifiable conditions. Okay, next we are going to discuss the types of hypertension. What is meant by white coat hypertension? The hypertension at clinics or hospital, when the patient is anxious or nervous while going into the hospital, the regarding may be higher than the normal. If he comes to the home and he once again measure the BP, then it is normal. This is called as the white coat hypertension or office hypertension. Okay, next we are going to discuss about what is meant by resistant hypertension. Resistant hypertension is nothing but the hypertension present even after treating with a 3 or 4 anti hypertension, especially the diuretic should be used to, if you wanted to say it is a resistant hypertension. With resistant hypertension we are going to involve 3 or 4 antihypertensives, but in the 3 or 4 compulsorily we are going to take diuretic, then it is called as resistant hypertension. Okay, next we are going to simplify our causes, because already we discussed the risk factors. Here also the same, that is the increased intake of the salt content and obesity, inactivity, that means sedentary lifestyle, and alcohol, genetics where we are told that is non-modifiable, and smoking, low potassium and calcium and magnesium, because the minerals are very useful in maintaining our blood circulation, etc., etc. We are going stress. We are going to discuss this thing, because the stress and anxiety, everything leads to increasing in the hypertension. Okay, let's discuss about our next topic, that is how to manage the hypertension. Okay, first we are going to discuss about the lifestyle modification. The best initial method is therapy is our weight reduction by doing physical activities and going to the gym, and therefore we are going to reduce our weight from normal, which results in the reduction of the weight. It leads to decreasing in the BP in order to supply the blood to all the parts. The tissue content is decreased, then pressure also decreased. This is the best initial therapy, that is a weight reduction. Next we are discussed about the physical activities are one of the types of which are going to helpful on our hypertension. That is our benefits of physical activities. What are some? See, here are the some benefits of the physical activities. We can maintain the body weight, and also it lowers the blood pressure and the heart attacks and heart diseases, and we are going to decrease the type 2 diabetes, which is going to be occur in the more than 40 years of age mainly, and reduction is on certain cancers, and increase in the muscle strength and bone strength also, and it also promotes the mental well-being, because on going to the park or grounds, etc., in the evening, it gives us this serotonin, which results in the happy hormone, and we are going to be happy. So then we are feeling well-being, both physical and mental well-being is there. Okay, and also it decreases the risk of the dementia. And we are also discussed that what is the diet given to the hypertension and diabetes is called dash diet. It includes the vegetable, fruits, nuts, fruits, fibers, whole grains, etc. Everything we are going to eat is the dash diet. Dash diet is the low fat and low sodium diet. Okay, this is the main diet which helps in reduction of our body weight, and also maintaining the proper BP in our future. So take dash diet is the best diet. Eat properly. One of the quote is that is the eat right at right proportion at right time. That means our nutrition, what you are taking, is a main factor for everything, because if you take food as a medicine, there is no need of taking of the medicine in our life.